Okay, so I'm going to be demonstrating how to start a peripheral IV. Okay, so I'm going to be demonstrating how to start a peripheral IV on this straw functioning as my vein. So, first step, after I've already got my tubing set and primed, placed all my materials, dated my transparent dressing, would be to apply the tourniquet at least 4 inches above the venipuncture site. So here would be, let's see, right at the top of the straw. It's not going to be as tight on a straw as it would be on a person, but be something. Here, as tourniquet works, I will then select and palpate for an appropriate vein, shaving if necessary. Here looks to be about a third of the way down the straw. In no greater than a minute, release the tourniquet. Now that I have discovered my site, I would then take a sterile prep pad, cleansing the area, circular motion in and out. Would then let this dry at least 30 seconds. Would then reapply my tourniquet using the same method as before. Using my non-dominant hand, which for me would be my left, then stabilize the vein above and below, where without flattening, without touching the site I had prepared. Before doing that, I would remove the cap on my needle with the bevel facing up. My camera's not gonna be able to pick that up, but it is facing up. With my thumb and index finger at about a 15-degree angle, I will insert my needles. Pretty thick straw, so that might not be super easy. It's a little bit more than 15 degree. Once I believe I have entered and I see flash in the flash collection chamber, I will advance slightly, which should provide catheter flash. Flatten my needle with my thumb and finger touching the tip of the skin, advance slightly further. And then I will press down to release the catheter as my needle withdraws. Before completely withdrawing my needle, with my saline already prepared, uncap. If I can get it off. Withdrawing needle, engaging the safety mechanism, I will place that to the side. We'll then attach my saline. Release tourniquet. Include the vessel above the vein. Should have been release tourniquet, occlude the vessel, then do the saline. Apologies, but I don't know. I can't use another needle. So while stabilizing the catheter, I will then pull back on the syringe and I see blood return. So I will now flush the site gently with saline. Okay, after I flush the site with saline, I will lock the extension set. So gradient kink here, tape to secure the extension set. So things are gonna start moving. All right, so the extension set is locked. I have secured the extension. I will place a transparent dressing over the puncture site with my initial dated and timed already on it, as well as the gauge of the needle. Okay, and then to remove this, that would involve another sterile prep pad, or first it would be releasing this gauze pad in a sterile way. So we're gonna act as if this dressing right here is my sterile gauze. I will have disposed of this needle already. Using a new alcohol prep pad, I will, while pressing away from the skin, remove the transparent dressing over the top, being careful not to tear the skin, removing it towards the middle. Once nearly removed, wow, this is so sticky. Once nearly removed, I will prepare my gauze with all of this in a bundle near the middle. And as I begin to withdraw my catheter, that didn't just happen. Oh, geez. These are just the worst gloves for this. My gauze in my left hand. My gauze in my left hand. I'm moving this towards the middle. As I withdraw the catheter, hovering it above, I will place my gauze over the puncture site and hold for roughly 30 seconds, checking the tip of this catheter, ensuring that it is intact, which it is. This will now be disposed of along with this glove. And after 30 seconds, I can put some kind of tape or secure that dressing. And that is it.